Hope you all are doing good. Today we are going to talk about how your diet has to be after the kidney transplantation. See, it having undergone a kidney transplantation or a renal transplantation, it itself is a big transformative change. Even physiologically, the body has a lot of metabolic challenges because of the hormonal shift, because of the immunosuppressions that the body has to get in, and because of the energy expenditure variances. There are a lot of challenges. Even if you talk diet wise, the first time then when you were diagnosed to have a chronic kidney disease, there are a series of different diets which you were prescribed, right? First, you were told to have some food which has low protein in it, correct? Then, when the stage progressed and you were put on dialysis, the protein intake was supposed to be increased because the protein losses happens because of the dialysis. Sorry, okay. So and now, after your transplantation is over, you might be thinking that, hope there is no more restriction. Now that you have undergone a kidney transplantation, there's no more restriction. But along with the kidney transplantation, there are set of few guidelines, the diet guidelines, which are to be followed. And these guidelines are for your better health. Because even to ensure that the new kidney that you have got works the best for you, there are few guidelines and few lifestyle changes that has to be followed. Even the diet that exists before your transplantation, it determines the outcome of the surgery, you know, because if you are malnourished before you undergo the surgery, it may cause a delayed wound healing. It may increase the chances of infection. It may pose most of the risk after the transplantation. And if you are obese, okay, even an obese person can be malnourished. So if you're obese before the transplantation, it increases the risk for cardiovascular diseases. It may hamper the wound healing. So a dietetic state or the nutritional status before you undergo a surgery also determines how your health would be after the surgery, or the surgical outcomes will be determined by that. And after the surgery, we will be put on steroids and on immunosuppressants. So these will cause weight gain. There are increased chances of getting diabetes. So to cut down the adverse effects, it's very, very important that you follow these guidelines. And these guidelines are not as restrictive as they used to be. Okay. And undergoing this transformation is a big thing, because having been attached to a machine for 12 to 16 hours in a week is quite tiresome, right? So now it's a boon that you have undergone a kidney transplantation. Fortunate that you got a exact match for your transplantation, and it's really time to watch out for a better life. Okay, so now let's see stage by stage how your diet has to be. Okay, now let's talk about the day when you undergo a transplantation. Now what I'm telling is based on the protocol. Now there are different hospitals and the protocol followed will be different as per their policies, but more or less the flow would be the same. So the day when you get undergo the surgery is called as day 0. So that day nothing will be given. Usually, seeing your condition, the doctor would prescribe to start with the liquids, because soon after the surgery you will still be under the anesthesia effect and you may throw up if something is given. So once you are stable, doctor feels that you're stable and you're fit to go for some liquids, they'll start with the sips of water. And if you are able to tolerate it, you're not vomiting, you're not throwing up, then clear liquids are given. Now what is a clear liquid? Anything which doesn't have a lot of residue is called as clear liquid. So you may get some clear juice, clear soups, or some black tea or black coffee, something like that will be given. Once you tolerate that, full liquids are given. So it could be milk, coffee, tea, porridges, that will be given. After you tolerate the liquid, semi-solid is given. So a mashed or a very, very soft khichdi kind of thing, a food that you can give to babies as soft as that. So a semi-solid is given. Seeing your tolerance, then the diet advances to soft and then to normal. Okay. So based on your tolerance, your clinical condition, the stages will be advanced. Next. Okay. Now let's see what are the challenges that you can expect after a renal transplantation. So if, as I told earlier, if your nutrition status was not that great before the surgery, we might expect a protein allergy malnutrition after the surgery also. So what you have to do is you need to have a good stores of protein. So I'll be telling about how to build up your protein stores later in the slides. Next, yes, you also have to expect that there might be some weight gain, cardiovascular diseases, hyperlipidemia, that means increased blood lipids level, or newly diagnosed diabetes, osteoporosis, sodium and water retention. These are all the things we can expect because of the steroids which you will be put on. Okay. Then there are immunosuppressants which will be given to you. Now, why immunosuppressants are given? Now, this new kidney is a foreign body for your body, right? The kidney that was there in your body was its own native organ. Whatever is transplanted is a foreign body. So body will think that there's some foreign body which is invading the body, and it tries to reject it. Now we don't want the new kidney to be rejected, right? So there will be some medication given, drugs given, so that the hyperactive immunity system becomes a little calm. So to calm down the immunity, immunosuppressants are given. So that with itself brings the risk of hyperkalemia, that is increased potassium level in the blood, high BP, high sugar levels, and again hyperlipidemia. So these are all the challenges that can come with immunosuppressants. And being on immunosuppressants, since your immunity also will be reduced, you are more prone to get infection from foodborne illnesses, right? Now, we are supposed to have a food which has very, very low microbial load. So we'll be discussing about this diet also, which is also called as neutropenic diet. Next. Okay. So first we have to talk how your protein stores are to be built up. So first 6 weeks after your transplantation, the aim of protein would be high. It will be around 1.5, say 1.2 to 1.5 gram per kg body weight. So how to get this protein? You have to get the protein from the high biological value proteins. So that means egg whites, lean meat, and all other protein sources like milk and its products, paneer, and the combination of pulses and a good carbohydrate rich food also, right? We have spoken about all this earlier in our earlier session. So you need to have high protein and also a good amount of carbohydrate in your diet. And the amount of calories required would be roughly around 30 to 35 calories per kg ideal body weight, so that you have enough carbohydrate and your body doesn't turn out to the protein for its calorie requirements, right? Once you recover, say after 6 weeks, your protein intake need not be so high. You need to come down to either 0.8 to 1 gram per kg body weight. So again, the source of protein has to be good only. It has to be high biological value protein only, but you don't need as much as 1.5 gram per kg body weight. And the calorie requirement has to be adjusted according to your body weight. If you're already underweight, calorie has to be stepped up. If you're maintaining, it has to be just a maintenance calorie. If you're already high, you have to cut down your calories intake so that you lose weight also, because that also determines the kidney health, remember. Next. So what is this NODAT? This is newly onset diabetes after transplantation. So as I told you, there'll be some steroids like prednisone or vicillin, or immunosuppressants like tacrolimus or cyclosporine. These things can increase the susceptibility for kidney, for the heart-related problem, and also increased hyperglycemia, because the body has a little reduced ability to use the blood sugar. Okay, so what do we do about it? We'll see that later. So first 6 months, the chances of getting a diabetes is more after the transplantation. The statistics says around 53% of post-transplant patients do develop NODAT. So what is the result of NODAT? It leads to reduced years of kidney function. So the whole purpose of getting the kidney transplantation is failed. So how do we fix it? It's up again the diet and exercise. Next. So what do we do regarding diet? You need to see how much of carbohydrate is going in. Okay, so around not more than 55 to 60% of your total calories should come from carbohydrates, right? So if it will depend upon what your height is, what's your weight, what's your BMI. So the dietitian will calculate how much is your total energy requirements, and of that energy, at least not more than 60 or percent of your energy should come from carbohydrate, that the dietitian will calculate for you, and you need to stick on to that. So what are the source of carbohydrate? We had already discussed, but which are the ones you should take? It is a carbohydrate which has to have a high fiber but low in glycemic index. So any carbohydrate which doesn't spike up your blood sugar levels, which has more fiber in it, are the ones which you have to choose. Okay, so again, it has to be something which has more fiber in it, say something, a rice with bran, whole wheat. These are the ones which does not spike up your sugar. So you need to go for such carbohydrate sources. And the simple sugars like sugar for the coffee, sugar for tea, for the juices, jaggery, honey, these are the simple sugars which you have to restrict. So as I told you, these do not have fiber in it. They just simply spike up the sugar in no time. Okay, and you need to balance your meals with a lot of proteins and vegetables. And as we had discussed earlier, a major portion of your plate has to be a vegetable, a quarter of it has to be protein, a quarter of it has to be cereals. And you may not be able to have a lot of protein at the same time, like in the meal time you may not be able to have all the protein rich food, so you can place it for in between snacks. So you may have something in the mid morning, you can have something in the evening. So mid morning some can be a sprout, right? Or evening you can have some vegetable salad along with some sprouts. So there will be diet plans given by the dietitian, you need to stick on to that. And you need to maintain or achieve an ideal body weight. So as we discussed earlier, if you're already weighing more than what you should, you have to cut down your weight. If you're already in the proper optimum range, you have to just maintain with that. So a BMI of 23 is what is something that we have to aim for us Indians. Now let's see how to prevent the hyperlipidemia or cardiovascular diseases which can come because of the steroids after the transplantation. So you have to look out for the fat sources. So as we told about the carbohydrates, same way, not more than 30% of the calories should come from the fat, and definitely no to the trans fats. Now, how do we get these trans fats? These are the ones which are available in present in bakery products and more of packaged fried food, which anyway is a restrictive item for you because packaged foods also has a lot of sodium in it. So you will be anyway watching out for that, right? And many patients ask what kind of cooking oil can they use. So it could be any of the healthy cooking oils, could be rice bran, soybean, mustard, gingerly, coconut, or even sunflower, soybean. But it has to be in the amount prescribed to you. Every oil is healthy unless and until you remain sticking to the quantities prescribed. So try to be well within say 20 ml or maximum 25 ml for the whole day. So the whole fat intake should be well within 25 grams per day. Okay, and use medium or low fat dairy products and avoid the high fat ones. So even when you purchase milk, there are different grades of fat percentage in them. So try to choose medium or low. And if you purchase a higher one, you need to try to boil the milk and remove the milk, the cream, so that you get the skimmed milk, and make the milk products also out of skimmed milk, right? So if you have to set for the curd, you try to boil the milk, remove the cream, or use the milk which was boiled the previous day, so that the creamy layer which comes, you can remove that and use the milk for making curd out of that. When it comes to non-veg, you have to prefer lean meat like fish and chicken, but again should be cooked in a minimum oil. And the types of methods for cooking has to be steaming, grilling, baking, roasting, boiling rather than frying. Okay, so you should make fish curry by not always deep frying the fish, but there are different methods of doing the fish, shallow frying, or you can wrap it in a banana leaf, or put it on tawa covered with a katori and let it cook with the minimum oil possible. Okay, osteoporosis. Now, what is osteoporosis? It is weakening of bones or the bones becoming porous. Now, why does this happen? Let's see what the physiology behind that. Now, kidney is the major organ which causes the assimilation of vitamin D. Okay, so whatever vitamin D you get from the sunlight or from the supplements that you have or the foods that you take, so kidney helps in the assimilation or absorption of vitamin D. And vitamin D in turn helps in the absorption of calcium and phosphorus in the bone. No, so calcium, phosphorus, vitamin D, all these minerals and vitamin are required for your bone health. When kidney is already compromised, these functions do not happen that well. Okay, so that's one reason why the bones become weak. Because your calcium level is low, calcium will be leached out from the bone. So again, there's a porosity in the bone. And after the surgery, as we told, the steroids are put. You are put on steroids. So steroids also leads to bone loss. So because of all these reasons, there's a osteoporosis which is setting in. So how do we deal with this? You need to have a doctor will be giving you mineral replacement supplements. So for supplementing all the calcium, phosphorus, and vitamin which is lost, doctor will be giving you medicines. And through the diet, what you have to do is you need to have adequate vitamin D supplementation and also exposure to the sunlight. At least between 10 a.m. to 2 p.m. at least you need to expose yourself to 15 to 20 minutes so that you have enough of vitamin D assimilation. And for calcium, apart from supplements which is being prescribed, you need to have skim milk and these products as we have already discussed so that your calcium levels are up again. Right? Next. Okay. Next is hypertension. Because of the medication and because of the renal issue, there are chances of again having the hypertension and fluid retention also. So again, as you used to do, you have to choose a low sodium diet. So even when you are purchasing things, you have to still look out for the nutritional label so that the sodium content is seen, and you have to cut down on the foods which has high sodium content. So some medication, as we told, can cause sodium and water retention, which can increase the blood pressure. So the salt intake in a whole day should not exceed 3 to 4 grams. Okay, this restriction is less as compared to the early stages of your kidney disease. So 3 to 4 grams per day means 3/4 of a teaspoon, right? So the same way you can measure it out, keep it aside, and for the whole day's food, you can add little of it and see to that you are well within the allowance. And all the salted foods like pickle, papad, sandies, and the packaged snacks, ketchups, salted nuts, and canned and preserved vegetables, ready to use food, all these things which has high sodium level or any food which is kept in a brine or a salty water solution, these things are to be restricted. And again, fluid restriction, as you used to be on fluid restriction, that's not required. You can have good amount of say 2 to 2.5 liters of water can be taken per day. But anyway, you will be discussing that with your nephrologist at your time of discharge, how you have to be on the fluid part of it. Hyperkalemia, again, having high potassium in the blood levels is called as hyperkalemia. Because of the medication, now there are chances of going into hyperkalemia. If the potassium level goes up, you need to stick on to the diet which was told earlier. Anything which increases the potassium level, all those fruits and vegetables are to be kept at little level at the restriction. So first few months, you will have to be on a weekly check of potassium level. Once it all settles, you need not follow any low potassium diet. If your potassium levels are all correct, you don't have to follow a low potassium diet. Only if the potassium level is going up, then you have to pose on the restriction. Otherwise, there's no such restriction required. So we were talking about the neutropenic diet. Because of the immunosuppressants, the susceptibility to get infection from the food is high. So you have to follow a neutropenic diet. What is a neutropenic diet? a diet which has a very, very low microbial load, something which is less cooked will have more of microbial load. So anything which is raw has to be avoided, at least for first 6 months. Okay, so let's see what happens here. So immunosuppressive medicines or anti-rejection medicines protects the kidney against rejections, but at the same time the immune system becomes weakened, so you become more susceptible for foodborne illnesses. So a neutropenic diet has to be followed till the time the doctor also advises you, but definitely for first 6 months. So let's see how to follow a neutropenic diet. Next. Okay. So all the safe and hygienic food handling practices are to be followed. Okay, while you're purchasing, when you're preparing, when you're storing, when you're handling the food, all the neutropenic diet guidelines are to be followed. So you have to avoid all the raw fruits, vegetable, pre-cut fruits and vegetables, something you do get in the market, right? Already cut vegetables and fruits so that your cooking time is minimal. Such things are to be avoided because you may not be cooking them. If you are just buying a salad and going to use it without any cooking, you are going to have a risk of infection. So any salad, any fruit has to be cut at home and then consumed. Unpasteurized milk, like drinking from a vendor which is not packed, a milk which is not packed, is prohibited. Anything which is pasteurized, packed, only such milk and milk products, juices are to be used. Which is anything which is not boiled or pasteurized cannot be used. Okay, avoid well water, even tap water. Just taking directly from the tap and drinking might be a little risky, so you might have to consider always filtering or boiling the water and then drink. Any cooked, undercooked meat, fish, eggs, raw nuts are to be avoided. So this anyway we had discussed that any fish or all the non-vegetarian sources have a lot of chances for increased infection rate. So any non-veg has to be well cooked and then only consumed. And the nuts part of it, yeah, you may have to do a light roasting and then only consume. So things you will have to remember is anything like say buttermilk or homemade buttermilk and all is fine, but fruit juices or cut fruits from outside vendors, or these candies, colas, anything which is made from outside, you'll have to restrict all these things. So anything homemade, freshly cooked are all safe for you. And even while handling the food, like food is prepared for a long time and you're having it quite late, also can be dangerous. So you might just think of preheating, making it sure for your consumption, and then having would be good. This is just a sample diet of how your diet has to be after your transplantation. So for example, if you wake up at say 7 o'clock in the morning, as we told, you need to this is a sample diet of how you have to be eating after a renal transplantation. So for example, if you wake up say 6:30 in the morning, if you prefer to have milk first, you cannot add sugar. You need to remember that. Even if you were not diabetic earlier, now you have to be careful that there are chances of increased sugar level, and you will have to avoid sugar in that. Okay, and the supplement, if the dietitian has prescribed a supplement for you in case your intake is less and she feels that you need to have some supplement, so milk with supplement has to be taken. Then comes the breakfast. So depending upon from which place you are, it could be South Indian, North Indian. So it could be dalia upma or a moong chilla or tomato omelette or ragi dosa along with egg whites. Okay, whatever is your breakfast, make sure that you take good amount of protein. As we had discussed, you need more protein now. Okay, it can also have the things which are not mentioned yet. Could be also some idlis or dosas. You can have a freshly cooked breakfast. Then, since you are not supposed to stay hungry for a long time, so from 8:30 to 1 o'clock is a huge gap. So in between, say around 10:30 to 11 o'clock, you can have some mid-morning snack. So what it could be? It could be fruits, but also you have to remember one thing is the diabetes, which you have to keep in mind, and also a neutropenic restriction, right? So any watermelon cut and kept for a long time cannot be taken. You can freshly cut a watermelon and you can have, say, 100 grams of it. Or chiku, banana, mango, pineapple are all something which can increase the sugar level. So if your sugars are all under control, maybe 100 gram of one of these also is fine once in a while. But otherwise, more safe would be a mosambi. You can have a sweet lime or an orange or a guava. So a small guava or 100 grams of watermelon. So these are the fruits which can be taken as a mid-morning. Prefer to have fruit, not the juice. Then comes the lunch. You can have some millet ka roti, it could be jowar or bajra, along with dal, vegetables, and any could be one of the vegetables which is prescribed to you. And make sure that you have salad along with it so that you don't get the problem of constipation. Tea time, again tea without sugar, but if you are happy to have milk and avoid coffee or tea, that's also good. And some snacks, some high protein snacks. It could be sauteed paneer with vegetables, or moong dal ka chila, or it could be sauteed mushroom, or if you're non-vegetarian, you can have some chicken chunks or soya chunks. You can have tofu or boiled corn or jowar flakes, or you can have some boiled egg also. Then comes the dinner time, 7:30 to 8 o'clock. Some millet roti, same like your lunch. You can have the same thing, but make sure again to have some salad. And bedtime, again milk without sugar, but with the supplement, right? Make sure that you have something before you go to bed, either milk or buttermilk, something has to be taken. And the salt intake, as we discussed, should not exceed 3/4 of a teaspoon for the whole day. Okay, so this is a sample diet. Based on your requirement, a dietitian can always help you to design the diet based on the problems that you're facing. So as a whole, I hope you're happy that you've undergone the transplantation and you'll take the responsibility of taking care of your kidney and your health.